Hi everyone, this is Ada Ojaid. I'll be doing a presentation on a case question on iron deficiency anemia. So this presentation is gonna be like a somewhat of a clinical simulation. So I'm gonna try to make it fun, quirky, and kind of make it realistic. Okay. So we have Betty here, who is a fun-loving teacher, a 49-year-old woman who is being evaluated at your office for reports of truncal lower extremity akathisia, and headaches for 7 months. So as you further assess and evaluate her and you perform your physical assessments, you noted angular stomatitis. You noted irregular cardiac rhythm, no organomegaly, mucosal pallor, and palpebral pallor. She has no GI complaints, so also with the assessment, no GI abnormality. So GI pathology is absent. Her recent lab studies reveal the following: hemoglobin 10, hematocrit 27, MCV 74, and RDW 16. So the question is, which type of microcytic anemia is consistent with this clinical picture? A, inflammatory anemia. B, thalassemia. C, iron deficiency anemia. D, sideroblastic anemia. So I want to first off, I'm a new MP. I want to say I'm a new MP. I'm still learning. So I just love to read up stuff and learn. And I love to construct questions. So I want to first off say that I truly apologize for my strong verbiage. I just cannot help myself. I like to use big words. I don't know why. So sorry about that. So the question stem is asking about a specific type of anemia. So the anemia that's portrayed in this clinical picture. So some key information that you need to know and you need to have to successfully answer this question is, first of all, you have to have a knowledge of atypical symptoms in iron deficiency anemia. Given that, iron deficiency anemia is the most common type of microcytic anemia. You also have to know the risk factors for iron deficiency anemia. And then thirdly, you have to know all the lab indexes for iron deficiency anemia, especially the RDW. That's a dead giveaway, when it's elevated. It's an indicator of iron deficiency anemia. The case presentation skews more on atypical signs versus hallmark signs because I'm just a little, I don't know if I should, I'm not a nerd, but I'm just a little nerdy sometimes. So I really love like complex things and I love to deal with things that are complex. So I love using atypical presentation because I feel like it increases my knowledge, and I think for you it will increase your knowledge, and it also increases the difficulty level of the question. So truncal is just itching around the trunk area. Lower extremity akathisia is restless leg syndrome, RLS syndrome. And headaches, these are some of the atypical or uncommon signs of iron deficiency anemia. One thing that I want to point out is the case demographic, or we can call it a risk factor. For example, she's a 49-year-old, so she's probably pre or she is menopausal, not postmenopausal. So other risk factors that I can I can elaborate for iron deficiency anemia will includes especially based on the prevalence rate or evidence-based data that's available. Women have the highest incidence. Women of childbearing age have the highest incidence. Pregnant women, pre-pubertal females, menopausal women, postmenopausal. Um, Men is about 2 to 3% prevalence rate. Then you have ethnicity such as African Americans and Hispanics are more likely to present with anemia than any other ethnic group. So another key takeaway from this is that elevated RDW is a good indicator for only IDA and certain malignancies. But however, it lacks the sensitivity that you get from iron studies or ferritin level. So the best answer choice for this question is iron deficiency anemia, which is C. So I truly hope that you learned something out of this. You know, it's important to know the atypical signs so that it will help you not to have errors in your diagnosis. Thank you very much for watching. I really appreciate you. Bye.